Cholesterol levels can be controlled to minimize the risks of heart disease and strokes, which physicians can address. Your risk factor level determines the goal level for LDL cholesterol. If you already suffer from cardiovascular disease or have a high risk, your LDL goal should be less than 70 mg DL. People with average risk tend to achieve below 100 mg DL through lifestyle changes good enough. You and your doctor can determine if you need to supplement lifestyle changes with statins or other medications. Some text goes here. What about the LDL cholesterol counterpart, high-density lipoprotein, HDL? HDL can be challenging to understand, given all the other factors we discuss regarding heart health. It's essential to take steps to monitor HDL as well, as this can contribute to heart health management. HDL is generally called good since it performs essential tasks. It assists in the processing of cholesterol in the blood and artery walls, and it returns it to the liver so that it may be removed from the body. This ongoing action prevents the formation of dangerous plaque. Guidelines advise an HDL level of 40 mg to 60 mg deciliters for men. According to Dr. Sachs, a group of under 40 mg deciliters could mean more HDL must adequately carry out its intended task. As HDL is categorized as beneficial, it would make sense that more HDL amounts imply greater security. However, studies indicate that this isn't always the case. As it turns out, higher levels of HDL beyond 80 mg DL do not confer additional protection. HDL is only entirely adequate if it is assisted. Research shows that HDL partially protects the body by regulating LDL and triglyceride levels, a type of blood fat categorized into low-density lipoprotein and high-density lipoprotein. A small study found that adequately dealing with cholesterol levels is ideal for preventing cardiovascular disease. Doctors use lipid panels to measure cholesterol, screen patients for cardiovascular disease risk, and monitor treatments. However, sometimes more detailed cholesterol information is needed. This requires advanced lipid testing to measure apolipoprotein B, ApoB, the primary protein present in LDL. Research has suggested that higher levels of ApoB can signal a greater risk. But only some people need to be tested for this test. For patients with high LDL or HDL, the additional details won't change their diagnosis or treatment. Explains Mrs. Frank Sachs, professor of cardiovascular disease at the Harvard T.H. Chan School of Public Health. Some people may benefit more than others from those with a stroke or heart attack, regardless of their risk factors such as LDL cholesterol levels, blood pressure, diabetes, or smoking. Some text goes here. A routine blood test, the lipid panel, measures your total cholesterol, LDL, HDL, and triglycerides. For some people who receive advanced lipid testing, see do you need advanced lipid testing? Lipid panel testing is essential to estimate the chance of cardiovascular problems. Your doctor will generally ask you to let low HDL stand, as in Dr. Sachs's example, damage hampered by low HDL levels is more drawn out and recurrent. Your doctor will generally ask you to let low HDL stand, as in Dr. Sachs's example, damage hampered by low HDL levels is more drawn out and recurrent. Aim to lose 5 to 10% of your weight if overweight. Switch from refined carbohydrates, white bread, white pasta, to whole grains, oats, whole wheat pasta, brown rice, and add protein-rich foods to your diet, such as poultry, tofu, beans, and lentils. Control your alcohol intake, if any. Don't smoke. If it becomes necessary, please seek medical assistance. Matthew, cancer and stroke survivor, requests that you help spread awareness of severe diseases by publishing this video. Please take a moment to subscribe to and like this video.